tRNA to
tRNA to
mRNA.
mRNA.
And if you
And
inhibit the
if you inhibit
transition
the
of
transition
tRNA
of
to
tRNA
mRNA,
to mRNA,
that
that
codon
codon
or the
or the
protein
protein
codon will not
codon will
transfer
not transfer
to in the
in the
chain.
chain.
So
So
basically, it is
basically,
tried
it
to
is tried to
inhibit the
inhibit the
protein
protein
synthesis.
synthesis.
And protein
And protein
synthesis, if the
synthesis
mechanism
is the
the
mechanism,
protein, how
the protein,
protein
how
synthesis
protein
happen?
synthesis happens.
tRNA to
tRNA to
mRNA, then
mRNA,
3
then
codon will
3
come,
codon will come,
then
then
protein
protein
chain or
chain
protein
or
synthesis
protein
will start.
synthesis will start.
So what they're
So what
doing,
they're
it is
doing, it is
binding with
binding with
30s
TS
subunit and
subunit
stopping
and stopping
tRNA to
tRNA to
mRNA.
mRNA.
After stopping,
After
protein
stopping,
synthesis
protein
will not
synthesis will
happen.
not
So
happen.
bacteria
So
will
bacteria will
die. And this
and
action
this
is a
action is a
bacteriostatic. It is
bacteriostatic.
not
It is
killing the
not killing the
bacteria.
bacteria.
It is inhibiting the
Inhibiting
growth
the
of
growth
bacteria.
of bacteria.
So that's
So
coming to
that's coming
category
to
of
category of
bacteriostatics. There are
bacteriostatics.
two
There are
different
two different
bactericidal and
bactericidal and
bacteriostatics. But
but
penicillin is a
penicillin
cidal.
is a sidal.
It does
It
not
does not
stop the growth of
stop the growth
bacteria.
of
It is
bacteria.
just kill the
Just
bacteria.
kill the
So
bacteria.
that is
So that
different.
is different.
So
So
bacteriostatics
bacteriostatics
means just
means
try
just
to
try to
inhibit the
inhibit
protein
the protein
synthesis. And
synthesis. And
sometimes bacteria
sometimes
may kill
bacteria
or bacteria
bacteria
growth can
growth
be
can be
stopped.
stopped.
Now
Now
connect here.
connect here.
This is the protein
This is the protein.
synthesis process. This is the protein synthesis happening because of this codon is moving. A amino acyl tRNA is attaching here to generate ribosomal template. Means ribosome template. tRNA to mRNA formation. So process of translation. So if the tetracycline bind in this 30s ribosomal subunit, now in the amino cell tRNA will not bind here and it will not continue protein synthesis. Protein synthesis will stop here. So this is the mechanism action of simple tetracycline. How this tetracycline act? It is acted by amino cell tRNA. So amino cell tRNA will not bind, then mRNA will not convert. If mRNA not will convert, so protein synthesis not happen. So this is a simple mechanism. Now understand the other way. This is a protein protein chain. So for changing the protein to continue formation, tRNA is come to bind here to convert mRNA. But because the tetracycline binding here, that means tRNA will not bind and it will not convert mRNA. So all the process will stop, and if the process will stop, so bacteria will destroy because of protein synthesis. Protein synthesis will not happen. Bacteria cannot survive longer period of time. Firstly, it will inhibit the growth, then finally it will die. So now coming to the point, tetracycline, there is a classification of tetracycline short acting, long intermediate, long acting. So what are the drug of short acting? Tetracycline, oxytetracycline, intermediate dimethylocycline, methicycline, long acting doxycycline, minocycline. So these are the drug which coming to the action of tetracycline. So now coming to where you can use a tetracycline, in which disease or which condition you can use tetracycline. You can remember this trick that tetracycline used for it's a mnemonics where forgot tat start from R rickettsia, atypical pneumonia, cholera, Lyme disease, chlamydia, LGB, and granuloma, or epidemic or plague. So these are the application of tetracycline where you can use tetracycline. You can use in cholera, you can use in Lyme disease, you can use rickettsia, pneumonia. So this is the use of tetracycline. Now, what are the side effect of tetracycline? So there is a side effect of tetracycline. So side effect, just remember the Kapil Dev. Kapil Dev means what? You can remember K for kidney failure. This is a side effect of tetracycline. A for anabolic effect, P for phototoxicity, I for insipid diabetes, L for liver failure, D for dental and declination, deformation of bone column, or expired tetracycline cause Fanconi syndrome or vestibular dysfunction. This Fanconi syndrome came so many times in GPAT exam. What the drug cause Fanconi syndrome? So example is tetracycline. And side effect, most common side effect of tetracycline, discoloration of teeth. Sometimes tetracycline is active on teeth, discoloration teeth. Can anybody, here is a one question, all of you. Why we cannot give tetracycline with the milk? Can have anybody having doubt or hope?
It forms chelates.
Ah, chelates. And it react with the calcium,
Yes,
right?
sir.
Because milk having the calcium. And how this tetracycline especially acting on teeth? What is the relation between tetracycline and teeth? Why it is
So the
because
teeth contains calcium.
okay, so that this tetracycline taking the calcium from the teeth, so it is enable
Yes,
disturbance.
yes, sir.
Okay, so this tetracycline now can anybody just keep in mind how many side effect without seeing the side effect? Can anybody remind the side effect? This is the tetracycline side effect.
Yes, sir.
Tell me.
So kidney damage,
Mm,
phototoxicity, discoloration of teeth, liver damage, teratogenic effect on fetus,
mm,
uh, then anti-anabolic effect.
Anti-anabolic, right, right. Okay,
Yes,
very
and
good.
importantly, sir, Fanconi syndrome.
Very good. So, Nisha, maximum side effects you remember. Anybody who can tell me if Nisha had skip or forgot some kind of side effect which you have in your mind that okay Nisha forgot this side effect I can tell. So please respond. Anybody?
Sir, one more
Nisha,
thing.
can you tell?
That
Yeah.
kidney damage, it is exceptional for doxycycline because doxycycline can be given in the patient who are having renal failure.
Yeah. Because tetracycline is having like it is generally why the kidney failing because it's a uh, isolate some also calcium from the bone and due to continuous deposition of calcium in renal, so it can cause the renal failure toxicity because deposition of calcium it can lead to stone, so that may be one reason. Actually, how this tetracycline affecting kidney failure, the cause is unknown. Like, but we can think about how. What do you think on that point? How the renal failure happen?
So
That
this tetracycline is taking calcium and some amount of calcium. So these metals are always having a big, like a great molecular size. So
okay,
it becomes very difficult for in the glomerular filtration and then pass through the nephron and get excreted.
okay. So good response because that the point actually I also understand because tetracycline make the bond of Chilich formation with some different metal also. So this duration of the filtration process is kind of great hindrance. So
Yes.
that is actually the side. But as we already discussed, the how this tetracycline reacting with the calcium, how this tetra, and that's the reason we don't give the milk tetracycline
Yes, sir.
same time because it can cause a food and drug interaction. So anything which you're taking with the calcium related, don't take tetracycline along with the milk or calcium containing kind of things. So it can cause some problem. So now Nisha, you understand with ecology
Yes.
tetracycline. So can anybody now? Mariam and Jonathan will tell the side effect actually. वो application of tetracycline. Where can we use it? Tetracycline. Just keep in mind and just tell me. I am just removing the slide. Just now, Isha, can you tell me some application where you can use the tetracycline?
Yes, sir.
Okay.
Sir,
Tell.
rickettsia,
Hmm.
relapsing fever,
Hmm.
then sir, this pneumonia,
Hmm.
uh, then sir, brucellosis.
Hmm.
Yes, sir, that's all.
Okay. Very good. Very good response. And you can do all of you can do one thing. Just use this techniques, right? And application in tetracycline, it is a written in tetracycline form. So if you suppose that if you forgot about how to remember rickettsia or tat, just leave it this PET and remaining what is the remaining application. Rickettsia, A for atypical pneumonia, C for cholera, Y for Lyme disease, chlamydia, LV, or something. These order. Uh, so in in side effect, you can remember this technique. Kapil, this will do. Suppose that if you forgot everything, you just keep in mind. His name is well known Kapil Dev. So you can correlate the side effect with this. So in your mind may not be coming side effect, but the trick is coming. Like, okay, there's a couple there, trick. So you can think about A for kidney failure, A for anti-annular effect, T for phototoxicity. So you can use this technique not only in the medicine chemistry, not only some kind of pharmacology. You can use wherever you want. Try to build some technique so that you will to remember so many things in very short of period of time. Are you agree on that point?
Yes, sir.
Because we have a lot of syllabus, we can't cover it very short of time. So but we can do one thing, we can just keep short note, and those short note must be having some kind of trick. So use just that trick and forget your syllabus and keep in your mind trick, and the trick must be in your fingerprint, finger point, right? So if you, let's say you, and the duration you forgot what side effect, what is the application, so वो आपके माइंड में वो ट्रिक है, वो ट्रिक आपको ड्यूरेशन एग्जाम में वो आपको हेल्प करेंगे. It can remember so many structures, so many name reactions, so many drug. Mostly I generally trick I use for classification, because KDT का classification 100 drug याद नहीं होती उसमें ना, बहुत सारी drug है. It sometimes it's a will happen the mixing. So for use all the trick and techniques so that you able to remember, you can cover everything what the parts your syllabus. So this is my personal point. I don't know how you prepare, but just try to do trick based learning activity. If you are learning and having some kind of different trick, so you can remember so many things. So tetracycline, there are generation also, first generation, third generation, and second generation. So these are some drug, first generation tetracycline, oxytetracycline, chlortetracycline, dimeclo, second generation doxycycline, minocycline, lime cycline. So these are some sort of drugs, right? So I made some kind of trick related to all the drug. There are some category of drug. I will cover up some antibiotic later on, but there is a something aminoglycoside inhibit always protein synthesis. Cephalosporin or beta lactam inhibit the cell wall synthesis. Tetracycline inhibit the protein synthesis. Penicillin we already discussed cell wall synthesis. Sulfonamide inhibit the folate synthesis. Fluoroquinones inhibit DNA replication. Macrolide inhibit the protein synthesis. Carbapenem, that means you understand whatever the drug is coming, cephalosporin, penicillin, carbapenem, the main role is cell wall synthesis, inhibition cell wall synthesis. But tetracycline, chloramphenicol, and these other macrolide is the main role to protein synthesis. Fluoroquinol is having the only role to inhibit the DNA replication or supercoiling. And there is another category of sulfonamide, 4. O, any folate antagonist. Folate, inhibit the folate synthesis. So this is a actually trick and technique where you need to, you can correlate MLT, MALT. MALT means the drugs coming aminoglycoside, microlate aminoglycoside, L for lincosamide, or T for tetracycline. So this trick is aminoglycoside, macrolide, lincosamide, and tetracycline. This is working on protein synthesis inhibition. So here is a category: protein synthesis. Fluoroquine. Fluoroquinolones is inhibiting DNA replication. So you can apply any technique. So now coming to the that point, antibiotic or sulfonamide category. Sulfonamide is this is the sulfonamide, basically benzene, ring, and sulfon or amide and amine group. So sulfonamide. Sulfonamide is having different of drugs. If you attach this ring on this R position, so you can make sulfanilamide. So some drug if you attach this ring. So this is the generally ring system where you are attaching. So before uh, so this is some drug ring system. If you attach this ring on this particular group, so you can make different sulfonamide drug. Acetate, if you are attaching with the acetate group, so sulfacetamide. Sulfadiazine, if you are attached this N and di, sulfadiazine. So now similar tetracycline have some kind of things. So this is a drug sulfamethoxazole. That also sulfonamide category drug. It is a ring find to isoxazole. So I am just taking the example how the drug of sulfonamide derivatives build. If you attach this kind of ring system, any from this ring, so it particular drug become like that. So I am just taking the example to attaching one drug, sulfamethoxazole. Now coming to classification of sulfonamide. Sulfonamide for synthetic use, sulfonamide of topical use. Sulfaxazole, sulfamethoxazole, sulfadiazine, sulfadoxine. टॉपिकल यूज में सल्फासिटामाइड, sulfasitamide and sulfadiazine are given to use in burning when somebody burn by something acidic burning or heat burning, so you can use sulfadiazine. These sulfadiazine, these generally given to sulfonamide injection. Now mechanism action of sulfonamide, if you take pyridine, power, so it will inhibit the dihydrofolic acid. So if you giving the sulfonamide, so PAVA and pteridine does not bind to make dihydro or dihydropteroic acid, or you can say folic acid. So if you block by this PAVA and pteridine, it does not going to make folic acid. If it does not going to make folic acid, then this bacterial DNA RNA will not form. So dihydrofolic acid, here it will work. To convert tetrahydrofolic acid, trimethoprim drug is given to inhibit tetrahydrofolic. This tetrahydrofolic acid is responsible for DNA, RNA, protein synthesis. So these three components are responsible for bacteria, DNA, RNA, and protein. So whether sulfonamide mechanism, PABA and pteridine bind with to make dihydrofolic acid. This dihydrofolic acid convert to tetrahydrofolic acid. So sulfonamide block dihydrofolic acid. So this is a simple mechanism of sulfonamide. So now coming to the discussion section. Hello, everyone.
Yes, sir.
We have covered three topics. I will ask you from three topics some question related to beta lactam, related to tetracycline, related to sulfon. Because can you tell me the what is the mechanism of sulfonamide?
The mechanism of action.
Sulfonamide.
Sir, the whatever it is shown in the slide, that only.
Hmm. No, that if it is suppose that you can have your understanding, you can share. It does not that is slide you whatever the understanding you have mechanical action of sulfonyl, you can share your or you can share from the slide. That is not easy.
Sir, mainly when para-amino benzoic acid, glutamate, and pteridine combines together, they
Hmm.
form dihydrofolic acid,
Hmm.
which is which is the action is proceeded with the help of an enzyme that is dihydrofolate synthetase.
Yeah.
And sulfonamide is the one which is inhibiting dihydrofolate synthetase, and it is showing the action.
Yeah, very good. If suppose that dihydrofolic acid is converting to tetrahydrofolic acid, what the enzyme is required or what the things it can convert dihydro to tetrahydro?
So, dihydrofolate reductase is used when dihydrofolic acid is converted to tetrahydrofolic acid.
Okay. So do you have remember from this not only from sulfonamide category, any of drug can inhibit the this conversion dihydro
Yes,
to tetra.
quatrimoxazole can help. Quatrimoxazole also inhibits the action of dihydrofolate reductase.
Okay, okay. There is another drug if you can remember other di- from dihydro to tetrahydrofolic acid. Is there any category? Not from the sulfonamide, it may be from any anti-cancer or from any. Do you know any drug? We need to correlation.
Yes, sir, there is an antineoplastic agent, but like I cannot remember very clearly.
Okay, methotrexate.
Methotrexate.
Hmm.
Yes, sir.
So methotrexate actually work on the dihydro
Folate synthesis, yes, sir.
tetrahydro. So now because we are not giving semester exam, we are giving GPAT exam, right? Firstly, so now we need to connect something from different topic so that you can remember, so that you can think about okay, this kind of mechanism actions coming from different other class of drug or other topic, right? So this is that
Yes.
is this drug generally coming the category of which category, which class is metabolite, I can say metabolite, right? Right. So metabolite category also come in anti-cancer. There is some drug working on anti-metabolite. There is a methotrexate also. There is a mercaptopurine. So that this comes in the category of anti-metabolite. So, but here the sulfonamide main role to not stopping dihydro to tetrahydro, stopping pteridine pavas to dihydro.
Mm.
Working pava pteridine should not combine to convert dihydrofolic acid. So that's why yeah, this drug is acting sulfonamide. But from the sulfonamide category, there is another drug who can inhibit dihydro to tetrahydro, that is trimethoprim. Trimethoprim actually working on dihydro to tetrahydro. But apart from the trimethoprim, the methotrexate also working same pathway. but action will be different. That is anti-cancer. There's a anti-bacterial action.
Antibacterial.
Right. So this
Yes.
is the common point, and what? So on, if I say the structure of point structure, just to keep in mind what is the sulfadiazine, what is the sulfacetamide. So that is not that much important. If the chemistry point of the question will come, they will give some a ring or complete structure. They will give four option. This is structure belong to which structure. They will just like that. Otherwise, they will ask correlation question. Correlation question is they will connect to some other topic also. From they will give some conditions how you can solve it. So that is the point. They will ask some side effect. They will ask this person having this much this problem disease or can be give to someone. Suppose that they will give scenario. The person is burning with heat. What is the best combination to give the person? They will give four options: sulfadiazine, sulfacetamide, sulfapyridine. So what is the best combination? If the person burn with heat, hello, hello,
Sir, sulfacetamide.
sulfacetamide. Yes, you can give sulfacetamide, but the best will be the silver sulfide.
Yes, sir.
Sulfur.
Silver containing. Yes.
Why? Because we are giving silver because maximum if you see any cream, burning cream, you will find with silver,
Yes.
sulfur. So that is a, and you can give, yes, you can give sulfacetamide, but sulfacetamide also, where it can also work on topically.
So it is
So
mainly for,
sometimes, eh?
then mainly it is for ocular infection, I guess.
Yeah. Yeah. So, but for burning condition, that
Silver sulfadiazine, silver
ah,
sulfadiazine.
silver. If suppose that the patient suffering from ulcerative colitis, so what is the best choice of drug?
Sir, sulfasalazine.
Sulfasalazine. So now we're connecting the question. What the questions? The question will not come simply. Keep in mind. The question will come in the depth of knowledge of inside specific. They will give four options: sulfadiazine, sulfasalazine, sulfapyridine, sulfamethoxazole. So question come specific. So that is a beauty of the try to get some class, because some of the portion you may not you may forward, but what's the question? The main role here comes expert. Expert, I suppose that those who have cleared the exam, those who have already completed, so they have some kind of understanding. Okay, this question comes. They will give reason. They will give the better. They now the GPAT or everything. They give four best option also, but you need to find nearest option. There's also little confused. Like say, there are four drugs given in ulcerative colitis. They will some other drug also. So now they will ask which is the best choice of drug. So already these four drugs is using for that purpose only. So that case we need to deep study. That is the role of actually. Incha, Isha, you must also
Yes.
respond. Uh, so are you getting the point or depth of the
Yes,
question?
sir.
So the question will not come simply. So the and sometimes they ask from they see. So these are topical sulfonamide, sulfacetamide, sulfadiazine, or sulfasalazine. So gets here and side effect. Huh? So now everybody we just just remind once again for only 15 to 10 minutes, just from and from your point of view, you just ask any kind of question or anything which is can help, or I will just remind to ask. If anybody, like suppose that I am taking the one thing, I am giving the situation, person suffering from pneumonia, right? And you are giving the penicillin or any kind of beta lactam related drug. It will be help, or you need to give the combination. Nisha,
We have to give the combination drugs, sir. Clavulanic
which
acid.
why we are giving clavulanic acid?
Because clavulanic acid is a beta lactamase inhibitor.
Yeah, right, right. So if you suppose that, so do you know any combination of or any drug? What the dose will be? How much penicillin? How much beta lactam will be combined?
Sir, I just remember the combination, not the amount.
Okay, okay, okay. So sometimes they also give the condition why you are giving clavulanic acid with beta lactam. So you have to be very unique concept why you are giving the combination, because of there is a bacteria have enzyme penicillinase. So penicillin as enzyme, what is they do? They will break down the ring system of beta lactam. They just break the beta lactam ring. So in that case, you need to kill first penicillinase, right? So the clavulanic acid does not kill the penicillin. It just give the false information, or for like misleading of the bacteria. It justly penicillin is understand, okay, this is a beta lactam. So it act as a acting as a on penicillin, but falsely beta lactam is a clavulanic acid react as a penicillin. So bacteria try to kill the clavulanic acid, and from the penicillin act or kill the bacteria. So that is confusing. Sometimes it's you have watched in movie, क्या होता है जब हीरो है ना, मतलब किसी को मारने की कोशिश करता है तो दूसरा भी उसको ध्यान भटकाता है कि भाई ठीक है, सो जब तक दूसरा अदर पर्सन कैन किल हिम. So likewise it happened with clavulanic acid. Bacteria understand, okay, this is a penicillin attacking me. So the bacteria try to kill that acting on clavulanic acid, and then penicillin kill the bacteria. So this is a happen with the bacteria. So Nisha, can you tell me what is the mechanism of penicillin?
Yes, sir.
Mm,
Cell
tell me
it it blocked the cell wall synthesis.
how. How you can see the slide, and just you can just tell me how this is happening.
It
Are you getting Nisha?
yes. It
Penicillin bind
it
with.
binds with penicillin binding proteins,
Hmm,
and then it blocks cross linking of peptidoglycan. Then bacterial cell wall synthesis happens and bacterial cell lysis.
very good. So can Nisha, can you tell me what is the which component is responsible for making the cell wall synthesis, or what is the how the bacterial cell wall actually made?
Sir, it is composed of peptidoglycan that is containing NAC and NAM, that is N-acetyl glucosamine and N-acetyl uronic acid.
Okay, very good. And can you tell me any in the between NAM and NAG there is a amino acid? How many number of amino acid present in the NAG and in that particular making this peptidoglycan?
Sir, how many chain you are asking?
नहीं नहीं chain, there is a particular amino acid number actually, and that to making this peptidoglycan or the namonec, if you see in there here,
Muramic acid.
I will show you. Basically 5 amino acids attaching with this. Are you able to see?
Yes.
So
Alanine protein. Okay.
huh, in this 1 2 3 4 5 alanine, glutamic, lysine, and alanine. Sometime the question they will ask in the back in the name and neck, how many amino acid is a responsible or which are the amino acid? So keep in mind 5. And what is the name? Alanine, glutamine, lysine, alanine. So I can be tell you the clear, all of you. The question comes in GPAT very, very tricky. What we accept, they don't, the question will not come. Whatever the things we read, okay, we have read about level synthesis, bacterial, all the things. They will ask how many amino acid. Are you getting the concept?
Yes, I got it.
Yes, sir.
So each and everything we must clear. So sometime they in the depth question they will ask what are the amino acid and what are the name of this amino acid. They will give serial. They can change. They can give phenylalanine. They can. So we need to correct find a proper serial. What are the so like, and sometimes they ask the question, which is the drug? Methicillin resistance penicillin. Methicillin resistance penicillin. So methicillin resistance penicillin में कौन सी ड्रग आप देते हो?
Amoxicillin.
Amoxicillin. In that case, you can take, but not amoxicillin. Not. What the drug you can give them? MRSA or BRSA case? BRSA or MRSA? Eh?
Vancomycin. Vancomycin.
Vancomycin. Or you can give linezolid.
Linezolide.
Linezolid. So, so this question, let me tell you, you can read all the things, so you can get simple question and simple answer. But sometime in GPAT they will ask us a specific question or all the. So in that direction, we need to prepare. Okay. So from I can ask from all of you, do have any kind of the doubt or any kind things in comes to your mind related to penicillin, tetracycline, and sulfonamide. So we can discuss on that point. कुछ डाउट है निशा? बीटा लैक्टम में है, अभी सिफोलिस्पूरी मैंने नहीं करा.
सर
ठीक है.
डाउट तो क्वेश्चन आने के बाद ही होता है सर, ऐसे पढ़ाने पे तो सब अच्छा ही लगता है, जब क्वेश्चन आ जाते हैं तो फिर डाउट आने स्टार्ट हो जाते हैं.
हाँ, तो on that you can do one thing. Just go thoroughly 3 टॉपिक पढ़ने के बाद तो फिर वो क्वेश्चन सॉल्व करना उनके रिलेटेड. देन वो क्वेश्चन का एक लिस्ट बनाना कि सर ये क्वेश्चन मेरे को समझ में नहीं आया. देन विल डिस्कस, राइट? आर यू गेटिंग द पॉइंट?
श्योर.
अभी 3 टॉपिक
श्योर
को आप अच्छे से करना. मैं स्लाइड शेयर कर दूंगा, अभी सर को भेज दूंगा. ठीक है.
जी.
इन स्लाइड, ये स्लाइड जस्ट हेल्प है, ऐसा नहीं कि इसमें पूरा इन्फॉर्मेशन मिलेगा. Are you getting? It just
जी.
select to inform you that how many drug, what is the mechanism, what is the side effect of that, and along with it, you need to go through that is book is Arvind Arora. I don't know how many aware or please bring take one book that is Arvind Arora pharmacology book and Spas Gupta. You can take from out of 2 book you can select. Just solve the question from the Arvind Arora. Then you will get to idea what kind of question they will ask. अरविंद अरोरा है सभी लोगों के पास?
Sir,
बस
if you
पूछ लो.
had soft copy, then you can send.
अरविंद अरोरा की सॉफ्ट कॉपी बेटा, इसकी सॉफ्ट कॉपी भी तो मिलती भी नहीं है ना, सबसे बड़ी बात तो ये है. अब स्टिल आई विल ट्राई टू फाइंड. डू ऑल ऑफ यू नो अबाउट अरविंद अरोरा बुक फॉर फार्माकोलॉजी? प्रैक्टिस क्वेश्चन की बुक है. नहीं सर, तुम भोपाल से ले सकते हो, वहाँ पे काफी मिल जाएंगी। सेकंड डंडी ले लेना या कहीं से आप जुगाड़ करो। रविंद्र और बहुत इंपॉर्टेंट है, बिकॉज फार्माकोलॉजी के क्वेश्चन विदाउट रविंद्र सॉल्व नहीं होंगे। ठीक है। हाँ,
ओके सर,
कुछ
स्पर्श गुप्ता चलेगा?
चलेगा चलेगा, दो सेम ही है, कोई दिक्कत नहीं उसमें। रविंद्र और स्पर्श गुप्ता सेम ही है। फार्माकोलॉजी के लिए स्पर्श गुप्ता रविंद्र और ले लो तुम लोग, एंड एक इनामदार ले लो तुम जीपेट की।
जी
ठीक
सर, इनामदार है सर।
है।
जी जी।
इन-
सर अभी जो केडीटी का 8th एडिशन आया है उसमें भी सर क्वेश्चंस आने स्टार्ट हो गए हैं, मतलब पहले वाले एडिशंस में क्वेश्चंस नहीं आते थे, केडीटी में आना स्टार्ट हो गए।
बट निशा, वो ना केडीटी वाले क्वेश्चनों में रविंद्र अरोड़ा में जमीन आसमान का अंतर है।
ओके ओके।
ठीक है, वो लॉजिकल क्वेश्चन नहीं देता केडीटी।
हम्म।
वो इनामदार अरविंद अरोड़ा में मिलेंगे। करेक्शन जैसे उसमें बहुत सारे क्वेश्चन आते हैं। जब यू आर समबडी ट्रीटिंग विद एंड पार्किंसन डिसीज, ड्रग ऑफ ब्रोमोक्रेप्टिन, सो पार्किंसन में ब्रोमोक्रेप्टिन दे रहे हैं, क्या प्रेग्नेंट लेडी को दे सकते हैं वो ड्रग? ऐसे क्वेश्चन आते हैं उसमें। अगर
ओके।
दे सकते हैं और नहीं दे सकते हैं तो क्यों नहीं दे सकते हैं? ये
हम्म।
क्वेश्चन है तुम्हारे लिए, बताओ।
तो मतलब क्लिनिकल बेस्ड है ज्यादा।
हाँ, क्लिनिकल बेस क्यों नहीं दे सकते हैं? अगर मैं सपोज पार्किंसन का पेशेंट हूँ और मेरे को ड्रग प्रिस्क्राइब है ब्रोमोक्रेप्टिन, ठीक है, तो
यस।
वो व्हाई कैन मिल्क फीडिंग वुमेन कैन नॉट टेक, व्हाट इज द रीजन? सो इट्स कोरिलेशन क्वेश्चन, समझ?
यस।
इसलिए नहीं ले सकते मिल्क फीडिंग वुमेन को ब्रोमोक्रेप्टिन इनहिबिट द मिल्क सिक्रेशन।
Yes, sir. Because dopamine is inversely proportional to prolactin.
हाँ, prolactin. Are you getting the correlation?
Yes, sir.
So
Yes.
if you want to solve so many correlative kind of question, please all of you take the solve the question of Arvind Arora. Then lot of question will come from. और मैं ही बोल रहा हूँ, जिसने अरविंद अरोड़ा कर ली वो उसका कोलोजी का क्वेश्चन तो गलत नहीं होगा 100%। फॉर एनालिसिस, इफ यू कवरिंग एनालिसिस क्वेश्चन, प्लीज प्रेफर द बुक ऑफ पाविया और रेमिंगटन। या तो आप रेमिंगटन से पढ़िए तो पाविया से पढ़िए।
Mhm.
So lot of things we will discuss. It is not just I am taking the class or sharing the PPT. It's not. Lot of things you, all of you, uh, get connect, or all of you ask any kind of, सर मैं कौन सी बुक प्रेफर करूं, कैसे पढ़ने की स्ट्रेटेजी अपनाऊं, क्या व्हाट शुड आई डू टू रिमेम्बर सो मेनी थिंग्स। ये चीजें भी आपको डिस्कस करनी आज के बाद। वेन एवर यू जस्ट गोइंग हियर एंड देयर एनीवेयर, टेक योर शॉर्ट नोट, पॉकेट डायरी, उसमें आप रखिए। जब आप कहीं जाते हो तो वो चीजें आप रिवाइज करिए। अदरवाइज यू कैन डू जस्ट लोड योर लेक्चर ऑन योर ऑडियो एंड वेर एवर यू गो टू आउटसाइड। 90% लोग सिलेक्शन पाते हैं जीपैड वगैरह में, दे ऑलवेज यूज टाइम यूज करते हैं जो टाइम उनका खराब होता है जाने में, मार्केट जाने में, कहीं कॉलेज जाने में। उस टाइम को यूटिलाइज करिए। घर पे जब आप पढ़ाई करते हो तो उस टाइम के लिए नोट्स बनाइए। जैसे आज मुझे, मैंने आज नोट्स उस चीज के लिए बनाऊंगा, जैसे आज मुझे अब मार्केट जाना है, उसमें 1 घंटा लग रहा है आने जाने में, तो मुझे घर पे रूम पर पे वो नोट्स बनाने जो 1 घंटे के लिए तैयारी मेरे पास क्या है। प्लीज यूज दिस स्ट्रेटजी बिकॉज वी हैव क्वालिफाइड, दैट्स व्हाई वी आर शेयरिंग विद यू व्हाट द स्ट्रेटजी यू हैव टू फॉलो इट। 98% स्टूडेंट रूम पे बैठ के पढ़ते हैं, एग्जाम की तैयारी करते हैं, जीपेट की तैयारी। नो, डोंट डू, जस्ट मेक द नोट्स वेयर योर मैक्सिमम टाइम जस्ट वेस्टिंग। वो आप उनके लिए नोट्स बनाइए। जैसे आपको अभी कहीं जाना है, कहीं वेयर एवर यू वांट, मेक द नोट्स, कीप द पॉकेट डायरी जो जो आपकी पॉकेट में है, ठीक है, या अपने ही नोट्स क्लासिफिकेशन के आप रिकॉर्ड करिए। ड्यूरेशन ऑफ जर्नी, जस्ट लिसन दैट। आर यू आर यू कनेक्टिंग विद मी?
Yes, sir.
By the end of your journey, by the end of your time, wherever you're going, market, whatever, so you will see your classification has been complete by default. So use this techniques. This technique is very unique, but maximum student can't use it. In the college or class, wherever you're going, just do your study. And because sometimes we need to talk with a friend also, because otherwise they will think, oh, कुछ ज्यादा ही पढ़ना। तो उस समय आप एक काम करिए, आप एक कान से अपने जो भी जिससे डिस्कशन करना है वो करिए, एक कान में अपना ही कुछ क्लासिफिकेशन का वीडियो नहीं ऑडियो रिकॉर्ड सुनते रहिए धीरे धीरे। तो आप इस तरह से अपने 24 आवर में से कम 8 घंटे और निकाल पाओगे पढ़ाई के लिए, जो बेस्ट हो रहा है हर दिन। Whenever we were cooking, whenever we were eating, whenever we were going outside, we have plan for each and every minute. Then I'm sure 100% from all of you, you would 100% you will get selected in GPAT. It is not depend on the, how much you have knowledge. It's a depend on the strategy, how you are, how, because now only 3 2 months remaining. If you don't make the proper strategy, you may not be crack. But you can crack the GPAT exam. That is not big task. But to getting secure higher rank or good rank, you have to be uh, make the time accordingly your some kind of trick or technique. Always use short notes. Always do your audio recording so that in duration of journey you can listen your audio recording. Like that, you don't able to remember the side effect, don't able to remember classification. Make listen 3 time 4 time, but listen only when you having some apart from your study time. Those whatever the activity you're doing in your home or room, you just make the notes that particular time. Okay, tomorrow or today I will going that particular, वहां पे आप घर पे सिर्फ नोट्स बनाइए और उन नोट्स का यूज करिए आप आने जाने खाने पीने के टाइम में. Then you will see miracle on with your, so you can maximize your time. So could you understand with my जो मैंने whatever I said, or otherwise you can do accordingly whatever you feel good method for preparation. But then that also one method where I I use duration of my uh, time that time. So it depends to person to person. So like concluding the this lesson today, we had a try to cover 3 topics: penicillin, tetracycline, and sulfonamide. So the next class we will try to cover it some other topic also related to. Uh, there are three component. One is infection related topics: malaria, viral, sulfonamide, or other anti-elements. So this is the infectious category. Now there are one class or one other categories: cardiovascular, insulin, hypertension. That is drug or related to cardio, and other drug is related to CNS or ANS. So this is a whole ecology syllabus like that. So this is a category of infection. So after infection, we will try to cover it cardio or some other. Then we will take ANS, CNS. So maximum topic we will in the 1 or 2 class we will try to finish it or related 3 domain. 3 सेमेस्टर होते हैं हमारे, 3 सेमेस्टर में तो 3 चरण चलती है. लास्ट सेमेस्टर में ये सारे आते हैं. इन्फेक्शन हो गया, एंटी टीबी हो गया, एंटीवायरल हो गया, यानी कि इन्फेक्शन कैटेगरी बोलते हैं इसको ना. उसके बाद जब 5th सेम या उसमें पढ़ते हैं, उसमें आपका रहता है सेकंड फार्माकोलॉजी या मेडिसिन केमिस्ट्री. कार्डियोस ज्यादा रहते हैं. कार्डियो रहेगा आपका, इंसुलिन रहेगा आपका, हार्मोन्स रहेंगे आपका, लोकल एनेस्थेटिक रहेंगे, और आपका फर्स्ट में रहेगा आपका एएनएस सीएनएस के पोर्शंस. इस तरह से कवर अप होता है. सो फ्रॉम 3 टॉपिक मुझे I can understand once you prepare with complete study, complete read after this topic. If anybody want to discuss anything, so it is open, or otherwise among these foundations. Chatale sir is there? No time last. Hello.
सर नेक्स्ट लेक्चर में कौन सा टॉपिक है?
नेक्स्ट लेक्चर में हम ट्राई करेंगे कि ये जो इन्फेक्शन कंटिन्यूसली चल रहा है ना, इसमें एंटी टीबी और एंटी वायरल या फिर हम एंटी फंगल, ये तीन तीन टॉपिक, 3 या 4 टॉपिक के सेट में ही करेंगे एक दिन में। एंटी टीबी, एंटी वायरल और एंटी फंगल, इसमें मैकेनिक एक्शन देखेंगे, ड्रग्स देखेंगे, उसको साइड इफेक्ट देखेंगे, इस तरह से हमारा चलेगा। फिर
Okay.
जैसे 6 सेम कंप्लीट होगा, 6 सेमेस्टर का ही पोर्शन है, वैसे ही हम 5th सेम का पोर्शन पकड़ेंगे जिसमें कार्डियोवैस्कुलर हार्मोन रहेंगे। और फिर एक दो क्लास में अपना रहेगा एएनएस सीएनएस रिलेटेड, जैसे हम पार्किंसन, डिप्रेशन। सो इस तरह से हम लोगों का,
एंटी कन्वर्सन से भी क्वेश्चंस आते हैं ना?
हाँ वो पूरा सीएनएस एएनएस में चलेगा। आज थोड़ा सा लिया है, अगर
वो
आप,
थोड़ा टफ जाता है मुझे, एंटी कन्वर्सन एपिलेप्सी का।
नहीं नहीं ऐसा नहीं तब कुछ नहीं है, तब वो ही चीज है जिसके बारे में पता नहीं है। ठीक है।
हाँ, उसके ड्रग्स वगैरह।
हाँ उसकी उसमें डोंट वरी होता है, उसमें जितनी भी साइकोटिक हैं आपकी ड्रग है, कन्वल्जन में जैसे बहुत सारी ड्रग। ठीक है। सो वो धीरे धीरे उसका भी होगा, वो उसमें कुछ टफ और कुछ सिंपल नहीं है। वंस यू विल अंडरस्टैंड क्लासिफिकेशन मैकेनिक्स। अब जैसे साइकोसिस की बात करूं, ठीक है, तो उसमें भी है आपका डोपामिन का जब लेवल बढ़ेगा तो साइकोसिस की तरफ आप जाओगे। ठीक है, बहुत सारे ड्रग है, टिपिकल एंटी साइकोटिक, टिपिकल एंटी साइकोटिक। ठीक है, उसमें ड्रग
यस सर।
वो सा चलेगा, क्या साइकोसिस है, बाइपोलर डिसऑर्डर क्या है, साइजोफेनिया क्या है। सो उसको आप ना रहिए टेंशन उसकी रहिए। आप तो जो सिर्फ इतनी चीज सोचिए जो आपने आज करा है, वो उसमें से कुछ चीजें आपके माइंड में कुछ डाउट छूटे, क्वेश्चन छूटे, वो आप मुझे बताइए प्लीज, है ना। उसमें से कुछ कुछ डाउट रहा इंशा, वो ईशा,
नो सर।
निशा,
No,
ईशा ने सर पढ़ेंगे तब तब पता चलेगा, अभी तो ऐसा नहीं पढ़ते सर
yes, sir.
चलता है। बट from your side, I just want to get your feedback. Uh, could you understand at least 20 to 50% from my class or not?
यस सर, अंडरस्टैंड वेरी
And
प्रॉपर्ली।
अच्छा, ओके। सो दे आर एक्चुअली, क्योंकि मैंने आई बिलीव दैट टू मच स्टडी नहीं होना चाहिए, है ना, कि बस पढ़ाई जा रहे हैं, सामने वाले के माइंड में कितना घुस रहा है ये इंपॉर्टेंट होता है। आई बिलीव दैट ऑन, इफ यू बिलीव और नॉट, व्हाट तुम्हारा क्वेश्चन क्या है उस चीज में, क्योंकि बिकॉज सबसे टफ सब्जेक्ट है मेडिसिन केमिस्ट्री। ठीक है, और इसको 1 घंटे से ज्यादा आप दिमाग दिल में घुसा नहीं सकते।
mm,
कि अगर आपने जितना मैंने अगर क्या है ना, इफ आई से बीटा-लैक्टम और टेट्रासाइक्लिन और ये सल्फोनामाइड, इतना आपने जितना करा है ना, उतना भी कर लिया ना, बहुत है। हर ड्रग आपने क्लासिफिकेशन कर ली, हर ड्रग का मैकेनिक एक्शन आ गया, बहुत है। दैट इज व्हाई वी डोंट नीड टू रश ऑन द टॉपिक टू टॉपिक। आई हैव पोटेंशियल, आई कैन कवर टीवी, आई कैन कवर, बट it does not make sense because your brain power have a limited kind of receptor, because receptor होते हैं हमारे ब्रेन में, उतना ही सुनते हैं जितना। so Nisha, do you agree or not?
sir, I agree, but like all the teachers say that every day we need to solve questions. So in Telegram, sir, I managed to answer 50 to 60 questions every day.
Okay.
But sir, offline mode, like in the paper when I solve questions,
Hmm.
for example, 125 question, and when the questions are wrong, for example, 2 hours or 1.5 hours, I take to solve all 125 questions.
Okay.
But for example, if 25% of them are wrong, so I need to read about that, sir, like why it is wrong. So it almost takes 3 hours in total, or more than 3 hours to solve one paper, sir. So
Okay.
how will I manage that? Because if I think that every day I want to solve 125 question or 200 questions, it becomes difficult, because after that I need to rectify all those which I made mistake also.
Yeah, Nisha, I agree on that point. But on that case, do one thing. Firstly, try to cover 3 or 4 topic particularly. Read everything about classification, whatever, right? Then please try to solve. Firstly, I will ask one thing to you. Are you solving the question related to any topic, or you are solving the question, the topic related to study recently? Like you are randomly you're just solving the question from,
Recently, randomly I'm doing it, sir, to increase my like skipping power, like from one topic to another topic, like in exams we do.
Okay, just like exam. So exam, just anything question comes. Sometimes it come analysis, sometimes comes medicine, chemistry, sometimes ecology, or sometimes cognosy, right? So we
Yes,
are
sir.
following like. So in that case, what happened? In that case, you are randomly solving the question, and randomly question coming from anywhere, right?
Yes, sir.
Sometime for initially we don't get the confidence because some study we have done it. So if
Yes,
study we have done it, then we can think about it. But we are solving the question randomly. Some of topic we even did not cover it
yes.
before.
Hmm.
So if you did not recover or cover it the topics, can anybody, if anybody even genius, can solve the question?
No, sir.
Because something he should study, then solve the question, then can make sense. But today, I did not discuss, I did not read about analysis, NMR or IR. And the question comes related to NMR. Just think about how can I understand? Because in the duration of my semester, I just read the superficial of NMR and question coming from very depth of knowledge of NMR.
Yes, sir.
So what will happen? We will confuse. मैं इतना पढ़ाई किया मेरे को तो क्वेश्चन ही नहीं
Yes,
बना.
lack of confidence, sir.
हाँ लेक ऑफ. सो पॉइंट आता नहीं यार, मैंने 150 को मैंने 125 क्वेश्चन किए, मेरे से तो 50 भी नहीं बन रहे.
Yes, sir.
होता है ऐसा?
Yes, sir. रोज होता है, sir.
ऐसा क्या मैं पढ़ाई कर रहा हूँ? सो इट विल क्रिएट confidence. It will not create confidence, it will lose the confidence, and
Yes,
it will
sir.
create confusion.
Yeah, right.
So to remove the confusion, just do one thing simply. Firstly read at least 5 to 6 topics,
Okay, sir.
and then solve the question only related to those topic only. Make
Okay.
the habit. Make the
Thank
habit.
you so much, sir. Like, I'll do it from now onwards. Like, because my confidence was getting so low after studying too much.
It is not for you only, Nisha. It is, can happen in the genius also. Because genius, think about I am the expert, or I'm think I love. Suppose that whatever the topic I have read at the time of my B farm, or and what the depth at that time, and based on that knowledge, I'm solving, try to solve the question, and it become difficult. It will lose your confidence.
Yes, sir.
Firstly, try to cover the 4 topic. Now I can tell you, if suppose that today I deliver 3 topic, after that you try to solve from these topic question only. Then okay, then you understand. सर ने बताया 5 amino acid, सर ने बताया ना ये बताया वो बताया. Then you can correlate. Then you can connect it. So solving the number of question does not make sense until you are don't study.
Yes.
Firstly, try to study and solve the question. Make a habit of it. Try to cover it per day, or some 4 to 5 topics, 6 to 8 topics. And whatever the topic you are covering, try to solve the question related to that topic only. Suppose that if you are studying NMR, then solve the question of NMR. Suppose that if you try to study today mass spectroscopy, then try to solve the question related to mass spectroscopy. Suppose that you try to study about Parkinson, depression, schizophrenia, psychosis, hormones related to, then you analyze the question of that particular topic. That is a simple phenomena for preparing. Today I have studied about the ecology, and randomly question comes related to mass, and even I did not study about mass. I will lose confidence, I will lose everything, and this practice make me to final the exam. I will having so much confusion. So to remove the overcome this confusion, you can do one thing. Try to read as much as topic, and try to solve as much as question related to the topic. Do the 10 days only. I'm not saying to do this 3 month. Do just 10 days.
Okay, sure, sir.
You,
I'll let you know in the next class.
then you see the miracle. Now I will start to discuss with the sir. I will send some question also, study material, which is made by me only. and this material, study material, will help you lot. Lot means lot. Try to make those, try to make the notes from that study material, because I have very selected study material. Specific question, specific answer. Okay,
Okay, sir.
and the question I have said this similar, solve accordingly, which I discussed. But suppose that you we read about suspension, so solve the question on suspension.
Okay.
If you read about tablet, because sometime what happen, random question solving, that means question can come from anywhere. Question can come capital. After the complete study, after the complete study, complete topic, then keep the 15 or 20 days to solve the random question only. Are you getting?
Okay, sir.
Before your exam GPAT comes, before 1 month, you try to solve the random question. That will be benefit, because if you doing the same practice and until the your GPAT exam you're not covering all the topic, then it will create huge confusion. And after the huge confusion, you will not be able to get confidence that how much study I have done it.
Right, sir.
Right? So likewise, we have taken the three portion like infectious. I am teaching also, but you try to finish like anything and random, random, not finish particular. Like if you studying from ecology, so if you studying from the ANS, or then after CNS, then after all the CNS related disease, try to cover this topic only, then solve the related to this question. Then you will see the confidence, your confidence go high, because you have recently study about psychosis related to drug or side effect. Then because मैं तुमको वही क्वेश्चन पूछना आसान रहेगा ना, जैसे अभी मैं प्रेजेंटेशन दी है, अगर मैं क्वेश्चन में उस प्रेजेंटेशन से पूछूं तो ना आपको पता है कि सर अभी एक ड्रग ली थी, अगर मैं एक प्रेजेंटेशन इसकी दूं और क्वेश्चन तुमसे एनएमआर की पूछूं,
डिफिकल्ट।
पैरासीटामोल की कितने पे पीक आती है बताओ जरा, कहाँ से आ जाएगा भाई, पढ़ाई नहीं ना अभी।
सर 8 पीक आती है सर।
नहीं, जस्ट एग्जांपल,
यस सर।
जस्ट माय क्वेश्चन, ट्राई टू अंडरस्टैंड।
जी जी।
तो ठीक है, तुमने पढ़ रखा है तो वो ठीक है, और मैं वो ही बोल रहा हूँ। सो सिंपल,
ओके सर।
सिंपल फिनोमिना, वंस यू स्टडी देन वो उन्हीं के भले सुबह तुमने आज पढ़ा, ठीक है, अभी मैंने कोलोजी पढ़ा 2-1 घंटे, जरूरी नहीं कि इमीडिएटली वो क्वेश्चन सोल्व करना है, शाम को कर लो क्वेश्चन सोल्व, और उस शाम की और मॉर्निंग की पढ़ाई में थोड़ा रिवाइज करो मन से, मन में आज मैंने क्या पढ़ा, ठीक है। सो वी आर here to help you, and we will tell you, we will not give so much information related to student, we will tell you technique, this technique will help you to selection finally, okay।
यस सर।
ये टेक्निक की जरूरत है, और स्टडी मटेरियल मेरे ग्रुप पे आता रहेगा, तुमको रेगुलर अपडेट रहता रहे, स्टडी तो तुम कर ही लोगे, वो तुम्हें कोई कमी नहीं है उसमें, बट कुछ टेक्निक कैसे फॉलो करनी वो उसमें विल हेल्प करेगा, ठीक है।
जी सर।
हम आज कुछ समझ में आया, नहीं समझ में आया, यही बताओ मैंने।
जी सर, समझ आया।
चलो अच्छा है। अब मैं ये सर हैं, क्या नाम है, बंधु सर, यू आर हियर, आई थिंक इज नॉट देयर, सो थैंक यू ऑल ऑफ यू, और इंसा यू वांट टू डिस्कस एनीथिंग, और
सर पियर्सन बुक कैसी है? पियर्सन एंड गाइड।
पियर्सन ठीक है बेटा, बट मतलब जैसे मैं अपना एग्जांपल बता रहा हूँ, मैंने मतलब उससे स्टडी नहीं की, तो हर बंदा उसको जिसको पढ़ा होता है, जैसे सपोज मैंने किलोजी रेंगेंड,
मैंने एक्चुअली एक ये ही देखा था वेबिनार, तो उन्होंने बोला था कि मतलब आपने बहुत ज्यादा स्टडी की है तो इनामदार सॉल्व करो, अगर ओके ओके है मतलब नॉर्मल तो पियर्सन सॉल्व करो, तो मैंने इसलिए पियर्सन मतलब ये किया है, तो मैं उससे देख रही हूँ, पर थोड़ा सा क्वेश्चन अनमैच हो जाता है उसमें भी, थोड़ा नहीं आता है इसलिए पूछा।
अच्छा, तो इन दैट केस यू डू वन थिंग, बिकॉज पियर्सन मैंने थोड़ी नहीं पढ़ी, मैंने अरविंद अरोरा पढ़ी है, और अरविंद अरोरा स्पर्श गुप्ता की काफी सिमिलर है, मतलब 98% सिमिलरिटी है, तो इसलिए निशा ने कहा कि सर स्पर्श गुप्ता, मैंने बोल दिया। पियर्सन मैंने थोड़ा सा मतलब देखा नहीं है, अगर मैं देख लूंगा तो मैं तुम्हें कंफर्म बोल दूंगा कि हाँ ये भी सही है, मुझे थोड़े से देखने की जरूरत है, सो दैट आई कैन कंफर्म यू, ओके। और जहां तक मुझे लगता है
ओके।
कि सुना है, ये भी अच्छी बुक है, अच्छी बुक खराब बुक से कोई मतलब नहीं है, हमें तो बुक वो चाहिए जो हमारे समझ में आए, सिंपल सी बात।
हाँ, नहीं अभी तो बस
मैं अरविंद
ऐसी।
अरोड़ा बोल रहा हूँ तो तुम अरविंद अरोड़ा से पढ़ो, अगर
नहीं
तुम्हें
नहीं,
बेसिक,
अभी
हाँ
ऐसी बुक चाहिए कि जिससे जीपैट के एमसीक्यू सॉल्व हो जाए ऐसी। इसलिए
जीपैट के एमसीक्यू अगर मैं कोलोजी में बात करूं तो एक बार तुम मतलब मैं देख के तुम बताऊंगा कि पेशेंट कैसी है, लेकिन अरविंद अरोड़ा और स्पर्श गुप्ता अमेजिंग बुक, मतलब आई डोंट हैव
हाँ,
वर्ड।
स्पर्श गुप्ता का है मेरे पास,
तो है,
सॉफ्ट कॉपी है।
सॉफ्ट कॉपी है, बट
हम्म।
क्योंकि अब जो बंदों को जो वाकई में क्लियर ही करना है जीपैट, तो मैं एक चीज और रिकमेंड करूंगा, डोंट गो फॉर सॉफ्ट कॉपी, बिकॉज वो जब तक फील नहीं आता है, जब हम पढ़ते नहीं ना, जब तक हमारी पेंसिल के कुछ निशान ना लगे ना, तो वो मजा नहीं है, मतलब मेरा पर्सनल व्यू है
हाँ,
तब
और वो
होता
सेकेंड हैंड वगैरह अवेलेबल नहीं था ना, इसलिए मैंने सॉफ्ट कॉपी से स्टार्ट किया था पढ़ना।
है। वो बहुत बढ़िया है, लेकिन मैं बोल रहा हूँ ना, तो बुकों पे जब तक हम वो हाईलाइट नहीं करते, जब तक हम उसको मतलब, तो वो सॉफ्ट कॉपी में नहीं होता। अब मैं रिपोर्ट
हाँ।
पढ़ रहा हूँ मेमोरी का, मैंने देखा है कि जब आप कोई चीज लिखते हो, सो वो आपको रहती है 80% याद, जब हम पढ़ते हैं तो ओनली 20%, और जब हम उसी पढ़ी हुई चीज को लिख के और फिर दूसरे को पढ़ाते हैं, वो 100% ब्रेन में चली जाती है। सो ये पढ़ने की और रिटेंशन पावर की भी मैकेनिज्म है, हाउ यू कैन रिमेम्बर। सो 90% जब आप या तो ऑनलाइन से पढ़ रहे हो, ऑनलाइन से, तो आप लिखो, फिर वो जो भी आपको पढ़ना है वो लिखो, नोट्स बनाओ उसके प्रॉपर हर चीजें। लेकिन जब आप हार्ड से पढ़ रहे हो, तो कहीं ना कहीं वो वहाँ पे हाईलाइट कर देते हो, आप कुछ लिख देते हो बुक पे, तो वो थोड़ा सा ऐसा। सो इट्स बेटर टू प्रेफर हार्ड कॉपी, इट इज पॉसिबल। नॉट पॉसिबल तो कोई दिक्कत नहीं है, आप उससे भी कर सकते हो, ठीक है। और मैं अब तुम्हारे लोगों के टच में रहूंगा प्रॉपरली, सो आई विल आल्सो शेयर सम नोट, शॉर्ट नोट, उनके आप चाहो तो प्रिंट आउट ले लेना, चाहो तो अपने मेरी शॉर्ट नोट के अपने और शॉर्ट नोट बना लेना, ठीक है, वैसे शॉर्ट नोट ही रहेंगे। सो इट विल हेल्प यू, अभी तुम्हें पता लग जाएगा, मैं 100 150 क्वेश्चन ऐसे ही रहूँ, वन वर्ड आंसर है उनका, स्पेसिफिक क्वेश्चन का आंसर स्पेसिफिक ही रहेगा। सो इट विल हेल्प यू सो मेनी थिंग्स, ठीक है, वो उस तरह से। और मुझे ऐसा लगता है कि थोड़ा थोड़ा पढ़ाई को, स्ट्रेटेजी को बस अलाइन करो, आपको सब इंटेलिजेंट हो, कोई नॉलेज में कोई कमी नहीं है, बट थोड़ा सा स्ट्रेटेजी में, जैसे मैंने बताया कि आप कहीं मार्केट जाते हो, आप दोस्तों के साथ घूमने जाते हो, कहीं भी जाते हो, आपके पास उसका प्लान होना चाहिए। आप नोट करो, आप रीड, आपको अपनी ऑडियो रिकॉर्ड करके आप जाते वक्त सुन सको उस चीज को, ऐसा करो सबसे पहले, स्टार्ट फ्रॉम टुडे इटसेल्फ। एंड सेकंड, डू वन थिंग, राइट द क्वालिफाइड जीपैट और नाइपर एग्जाम इन 2000, वो लिख दो आप प्रेजेंट में, ठीक है, बड़े बड़े अक्षरों में, दैट्स द पावर ऑफ ड्रीम, बिकॉज यू हैव मस्ट बी पावर ऑफ ड्रीम, क्योंकि कहीं ना कहीं पावर ऑफ सबकॉन्शियस माइंड आपको ला देगा वो जो आपको चाहिए। रिटर्न गोल लिखो, गोल मतलब कि मुझे, मैं क्वालिफाई कर चुका हूँ, और 3 4 ऐसी जगह पे, वॉशरूम फ्रीज, कहीं भी आप चिपका दो बड़े बड़े कलरफुल करके, ठीक है। दूसरा आपको करो, अपनी अगर जो घर की दीवार है और आपको स्टडी रूम सेपरेट है, सो ट्राई टू राइट समथिंग, ड्राइंग समथिंग, मेक एनी एक्शन, ड्रा क्लासिफिकेशन इन सम रिटर्न फॉर्मेट में, कलरफुल डायग्राम के साथ, वो भी आप चिपका दो, पढ़ो मत उनको, चिपका दो। बाय द एंड ऑफ मंथ और आफ्टर योर स्टडी, मेरे पास अभी मैंने 2012 में क्वालिफाइड किया जीपेड, उसके बाद 14 में मैंने एम फार्म रहा, ठीक है, फिर मेरा पीएचडी भी रहा। सो मैं उस समय का होता है, मेरी रूम की दीवारें पुती हुई रहती थी, मतलब तो सबका अपना अपना इंटरेस्ट है, ये मैं यूं ना बोला तुम भी वही करो, बट डू समथिंग, स्केच पेन लाओ 8 10, उसमें सब कुछ मैकेनिक एक्शन ड्रॉ करनी है, बड़े बड़े चार्ट में चिपका दो, धीरे धीरे बढ़ते जाओ, उनको याद नहीं करो, आप चिपका दे जाओ, धीरे धीरे आप देखोगे कि वो कहीं ना कहीं आपको दिन में 1 2 बार दिखा बाय डिफॉल्ट, वो चीजें आपको याद हो गई, वो चीजें आपके ब्रेन में चली, इट कैन हैपन। हाउ, विच नोट्स यू नीड, मैकेनिक एक्शन याद नहीं हो रहे हैं, ड्रग याद नहीं हो रहे हैं, आप क्लासिफिकेशन चिपका दो ना, याद नहीं करना है। और धीरे धीरे में तो आपको टेक्निक भी सिखाऊंगा, कैसे आप क्लासिफिकेशन करोगे, बहुत सारा। और आप प्रॉपर क्लासिफिकेशन चेक करना चाहते हैं, ऑलवेज रीड द इंडेक्स, इंडेक्स पे जाओ, इंडेक्स पे देखो, रैंडम सिलेक्शन ऑफ ड्रग, अच्छा वो उसमें ड्रग देखनी है, कौन सी कैटेगरी ड्रग है, मेमोराइज, एनहांस द मेमोरी, इंडेक्स से आप, जिस दिन आपको 100% ड्रग इंडेक्स से याद हो जाए ना, रेंडमली समझना आपका क्लासिफिकेशन कंप्लीट है। बिफोर क्लासिफिकेशन, क्लासिफिकेशन कैसे, कोई ड्रग आई, लेट से निक्लोसामाइड आई, ठीक है, निक्लोसामाइड कहाँ आती है,
पोटेशियम वो इफ्लक्स करवाता है सर।
बिल्कुल, बहुत बढ़िया। सो ये एग्जांपल ही ले रहा हूं मैं, रेंडमली, प्राजिक्विंटल कहाँ की ड्रग है, क्या मैकेनिक एक्शन है, इस तरह से नाइट्रोफ्यूरेंटन कहाँ आती है। सो ऐसा ये इंडेक्सेस होना चाहिए आपका, समझ रहे हो। कोई भी ड्रग आ जाए इंडेक्स पे, तो कोई भी ड्रग कहीं से भी आ जाए। कहाँ आती है, रिफाम्पिसिन कहाँ पड़ी है, रिफाविटिन कहाँ पड़ी है, इस तरह की।
एंटी ट्यूबरक्यूलर रिफाम्पिसिन।
हाँ एंड सो ये ये ऐसा हर ड्रग के लिए होना चाहिए। इस तरह से अपने ग्रुप के साथ में, अपने दोस्तों के साथ में कुछ वो बनाओ, क्या बोलते हैं उसको, अपना कुछ इस टाइप का डिस्कशन, इस टाइप का डिस्कशन करो, उनको व्हाट्सएप चैट करो, ठीक है, बोलो कि कौन से ये किस कैटेगरी बिलोंग है, इसका मेथड ऑफ एक्शन क्या है। हम 98% व्हाट वी डू, वी विल डू 98% व्हाट्सएप, इंस्टाग्राम, ये सब, ठीक है। लेकिन हम वही सेम चीजें टर्न करनी है, वो यूज उन्हीं टेक्निक, उन्हीं डिवाइसों को यूज करके डिफरेंट टेक्निक, किसी से राइट अप करना है, किसी चैटिंग करनी है। अगर अपने आपके ग्रुप, क्योंकि आप तैयारी करते हैं, तो उनके ग्रुप के लोग भी वैसे ही होते हैं तैयारी करने वाले, तो उनसे अपनी तैयारी करवा, वो भी, ठीक है। तो इस टाइप की चीजें आपको करनी है। आपको जब इस टाइप की चीजें आप करोगे, इट विल हैपन, ठीक है। वेन एवर यू डिस्कसिंग समथिंग, क्लासमेट, बैचमेट, उनसे मतलब ये ड्रग किस कैटेगरी की है, ये कहाँ से आती है, साइड इफेक्ट क्या है, इस तरह से रिवीजन फास्ट होता है। सो डू फास्ट रिवीजन, और नाउ वी विल बी इन टच इन दैट ग्रुप, okay. So here actually whatever I want to discuss with you, I have discussed everything. So you can use your strategy related to. Now there are so many people connecting with us. End of my actually my session is end. So I simply say to is my batchmate actually Pandu sir. So Pandu sir is we are here. I think one of my friend Malik is there. Hello Malik sir.
Hello, how are you, Surendra?
I am fine, Malik sir. Actually, today was my lecture on to this topic. So actually, my class is over. So just we had just open answer and question session. So from the student, so they have so many query and something how they implement their strategy of study, and what they should do duration out their paper. So after my session, I will just discussing what are the strategy you have to follow and how you can utilize your time, how you need to prepare well. So I must introduce Dr. Maulik Gaza, and he's basically Nigerian, and now he's a professor. So Maulik, you can also tell some suggestion to student, how can they prepare for BEL, for GPAT, what the strategy they must use. So you can guide them, you can help them, you can inspire them, or you have, if you have some kind of suggestion, please provide them. Thank you, sir. Thank. Actually, I was waiting you. I have from lot of time. I saying 3 to 4 times. I just announced your name, sir. You are here. So okay. So that is not a because. So now, so to over to you, sir. You can just guide them, your student. My class is over, and I was just explaining after the class, kind of open and answer question session. So from my side is over, sir, and now you can lead this meeting. Okay, sir. Okay, sir. So, sir, you can just have Hello, hello,
Yeah.
Malik sir, you can answer.
If students want a few minutes break, then I will start after 5 or few minutes.
Yes, they can take break.
Yes, a 5 minutes break, sir.
Okay, so we will start at 4:10. Okay. Okay. Okay.
Bandhu sir, can we leave them? We can rejoin again.